So the article titled Effective Early Mobilization Program in addition to diaphragmatic breathing exercise versus incentive spirometry on diaphragmatic excursion and PEFR in patients with abdominal surgery, a randomized control trial. So this study was carried out by an assistant professor and then a professor with their master's in physiotherapy at the Clue Institute of Physiotherapy in India in an Indian tertiary care setup in 2015. It is a level 2 randomized controlled trial. So there were 30 participants that were used in this study. They were randomly selected from an adult post-operative open abdominal surgery. Exclusion criteria would be it's like this long list of different, basically like any other type of surgery. If it's like a high risk patient, and then so the results or the purpose of the study was to compare the effect of early mobilization program with diaphragmatic breathing exercise versus incentive spirometry in post-operative abdominal surgery patients. So the interventions were the participants, which were 30, were split up randomly into two groups of 15. Group A was given diaphragmatic breathing exercises. So participants breathed in slowly and deeply through the nose and then exhaled slowly through the mouth 3 to 4 times and then rested. They would repeat these exercises 3 to 4 times after the rest. And then the early mobilization consisted of ankle toe movements, knee and elbow flexion, and extension. And then group B was given an incentive spirometer where they would inhale and exhale 3 to 4 times and exhale maximally on the fourth breath. Place the mouthpiece in their mouth, inhale maximally to a target setting, and hold inspiration for 3 to 5 seconds. They would repeat this 10 times. And then the early mobilization program was the same as it was in Group A. And then these two interventions were given twice a day for 7 days. So the data collection was used, it was a non-probability sampling method. And then the level of significance was less than 0.05. So that puts it at 95%. So the study's pretty accurate. There's not much room for error. So measurements were taken on the first day before interventions and on the 7th day after the interventions were completed. Diaphragmatic excursion was measured by the mediate percussion method. Peak expiratory flow rate was measured using Wright's mini expiratory flow meter, which is spring-loaded and enclosed. Pain was measured using the visual analog scale. Chest expansion was measured at axillary, nipple, and xiphoid level. So the results of the findings were both diaphragmatic breathing exercises and incentive spirometry show benefits, but the diaphragmatic breathing exercises are more effective. So the limitations of the study it was only done on one type of population. So all the patients were patients who had abdominal surgery. Implications would be future studies should include a larger sample size with a longer follow-up period to assess long-term benefits.